Well, welcome to today's update. It is Saturday the 25th of April. So I want to do a little bit about what the World Health Organization's been saying this morning. Then I've got a report from the United States and from Europe. And in Europe today, we want to particularly think about the reopening strategies that are currently being thought about. And then we'll have a slight memorial of Anzac Day when we look at Australia and New Zealand. So let's start with what the World Health Organization is saying at the moment. Now, first of all, of course, we have a total number of cases in the world now approaching 3 million. These are official confirmed cases. We know the real number is way higher, of course, and the number of deaths now is approaching 200,000 even by official criteria, but even that we know is a great underestimate. Now, the World Health Organization is saying, they put this a funny way, they're saying there's no evidence you can't catch COVID-19 twice. So what they're saying is they can't say that people who have got COVID-19 will not get it again. They're saying there's no evidence you can't get it twice. So they're saying there's no evidence for that. It's a bit of a strange thing to say. But they go on to say even if recovered people have antibodies. So what they're saying is even if people have antibodies, there's no guarantee that they're going to be recovered. So what are they saying here? Well, we know that if someone's infected with a virus, that's the antigen, then the immune system develops antibodies. And then the reason they get better is because the antibodies are getting rid of the disease. The World Health Organization is saying there's no evidence these people are now immune. Now, if this is the case, it's very unusual with viruses in general, and it's very unusual with coronaviruses. And also, there's some early evidence that plasma donations from recovered individuals help those that are acutely ill because of giving them their antibodies. So this is all rather strange from the World Health Organization, but they do have major experts there, so we have to take it seriously. And so they're warning against this idea of an immunity passport or a risk-free certificates. So I've been saying that the hope is that when people have had the disease, they'll then be immune to it and they can return to normal duties. But the World Health Organization is saying, well, there's no evidence for that. So it looks like they've gone all very evidence-based all of a sudden. Now, whatever I say about the World Health Organization, I get complaints, so I'm not going to say too much about it. People complain that I support it too much. People complain that I'm attacking it. I'm doing neither. I'm just trying to objectively evaluate what they're saying. And this is what they're saying today. So what they're saying is that even when people are recovered, they have to keep to standard advice of social distancing, hygiene, all the anti-transmission factors that we've now become familiar with. Now, they do say that antibody tests are not always reliable, which is certainly true, and they can give false negatives and false positives. So a false negative would be saying someone who has actually got it appears to be negative, and a false positive would say someone appears to have it when they don't actually have it. So these tests can give both. So real challenge to the scientists of the world there, give us a test that costs about 50 cents or $1, please, and is completely reliable. Is that too much to ask? I know it's difficult. Because Chile have been talking about the idea of health passports, you see, for people that have had the illness and that have now recovered. So that's what they're saying. They're just saying there's no evidence you can't get it twice. So it sounds like they're being very cautious all of a sudden. So I thought that was interesting. A lot of people believe, as I strongly suspect, that once you have had COVID-19, you are going to have at least a degree of immunity to it, probably a strong degree of immunity to it. The virus does not seem to be mutating very rapidly, or certainly not in ways that would mean that the immune system would not recognise it a second time. And we know that people infected with other coronaviruses often are immune for a year or 18 months, which would be okay, because that would be enough to get the vaccine. But that's what they're currently saying about that. So, interesting. Now, the United States, nearly 1 million cases, and a grim milestone here, well over now 50,000 deaths, unfortunately, in the United States. Now, a lot of the outbreak in the United States so far has been in the cities, but it's now going to the heartlands as well. So in the past week, this is in the past 7 days, 99% of increases in cases in Nebraska compared to this time last week. Iowa, a 90% increase in cases in the week. Arkansas, 60% increases in the week. South Dakota, 44% increases in the week. And Oklahoma, 26% increase in the week. So looks like the COVID-19 is starting to become established with community transmission in heartlands as well as city areas. It was inevitable, but it is disappointing that it's happened so quickly. Now, reopening leaders, so this sort of reopening movement that's in the States now. So Georgia seems to be out ahead with its reopening ambitions and strategies. But Florida, South Carolina, Mississippi, Alaska, Ohio and Tennessee all looking at reopenings soon, if not starting to happen already, reopenings within the week. Now, as these reopen, this will mean there'll be an increasing number of cases. And a proportion of those cases will be sick and a proportion of those cases will die as a result of the increased social contacting that will occur as a result of these reopenings. That would be my prediction. I make no comment on it. I'm not a state governor, but that is, as I understand it, the science of the matter. Now, interesting study I'm reading through, trying to make sense of, from JAMA, Journal of the American Medical Association, studying 5,700 patients in New York. I'm hoping to do a separate video on this because it's a very interesting study because these are audits carried out in New York, so we know the data's accurate. It's not dodgy like, or questionable rather, should we say, as some of the data that came out of China. This is a good number of cases in New York and surrounding areas. So I'm going to report on this paper and we'll have reliable information on this. But something that's just jumped out at me so far. Now, these were all patients that were hospitalised, 5,700 patients that were hospitalised. So this is not the cases, this is those that were hospitalised in this particular target sampling area. Now, in terms of comorbidities, of those that were hospitalised, 56% had hypertension. And this is what I have been hearing from nurses and doctors in the UK, that hypertension seems to be a very common comorbidity for this illness, people with hypertension. And so far, I haven't seen any studies that distinguish between people that are prone to hypertension developing COVID-19 complications or people that are being treated for hypertension. So I don't know whether it's the fact that people are hypertensive or with a tendency towards hypertension, or whether it's the medication. I haven't seen any studies that separate that yet. So I get asked that all the time, and the answer is, as of now, I don't know. Someone may know, but I haven't read that literature yet. So someone can certainly let me know if they can differentiate between whether it's the hypertension itself or whether it's the treatment or what it is. But nevertheless, that is there. 56% of patients admitted to hospital had hypertension, a history of hypertension. And again, not completely unsurprising, as we've seen from other data, 41.7% of those admitted in this hospital sample in New York. It's not what they did was they took particular hospitals and they took all the patients that were admitted there for over a month. So it was a sequential study. So it's not as if they're picking patients. It's fairly randomized study. So 41% obese, and diabetes, 38% were diabetics. So they were the three leading comorbidities, and of course these are remarkably common all around the world and in Western countries. Now, we used to say these were diseases of Western civilization, but now hypertension and diabetes especially is a global pandemic. And that's a separate topic, but huge amounts of people are diabetic all around the world, mostly type 2 diabetes. But huge numbers, significant percentages of the world's population. something like 8-9% of the world's population at the moment are probably diabetic or insulin or glucose intolerant. It's huge levels like that. And of course, a lot of people, especially in Western societies, but increasingly in many underdeveloped areas as well, obesity is quite common. So common comorbidities, and that was the way that they were ranked: 1, 2 and 3 in this study, but more on that study later on. Not on this broadcast, another time. I still haven't finished crunching it yet. It's a reasonably complicated study. It takes a while for me to make sense of it. Now, there's a trend in Europe for reopening. But just before we go on to that, Europe's trying to raise 8 billion to make supplies available globally. Now, this is very encouraging. When this vaccine comes and the PPE now and all the other things that we need now, we need a global distribution of these. We don't want haves and have-nots. When this vaccine comes, we want it to be available for everyone. When secondary infection comes, we want the antibiotics to be available for everyone, not just for a few. Now, carrying on thinking about Europe, cases in France with very rigorous lockdown. France political leadership has been trying to stimulate other people in the world to cooperate with anti-COVID-19 ventures. So quite a lot of cases on their own, 22,000 deaths in France, high number. Now, interestingly, Haberdashery, now I'm not much on sewing and things, but I think haberdashery just means anything to do with sewing and buttons and cloth and thread and needles and things like that. So haberdashery shops are reopening early in France. The reason being it's to encourage people to make their own masks. So I thought that was really encouraging, that people can make their own masks, because we need people to be wearing masks in public, in my view, especially on public transport, especially in supermarkets, so that infected people do not infect uninfected people. Spain. Now, a lot of cases in Spain, of course, as we know. This was the deaths up to today, up to Saturday. So they're the Friday to Saturday deaths. They're the Thursday to Friday deaths. Disappointing to see a bit of an increase. But of course, we do know that the overall trend is down. But it still leaves over 22,000 people in Spain no longer with us. Belgium. Again, relatively small country, Belgium. So quite a lot of cases per capita, quite a lot of deaths per capita in Belgium. Small country. Starting reopening on the 11th of May. And I'm glad to see that, I think it was over the age of 10 or 12, over the age of 12 I think, masks on public transport are going to be mandated. Legal requirement. It's just such common sense to me, I just don't know why more people aren't doing this. Now the UK cases are increasing. These deaths are hospital deaths, so we know it's an underestimate by probably 50%. So the real death rate in the UK now, sadly, is I'd be amazed if it's less than 30,000, unfortunately, because of deaths in care homes and deaths at home. And the World Health Organization have been saying that up to 50% of deaths in Europe could well be in care facilities, nursing homes and care facilities. So unfortunately, that number is going to carry on rising. Another 768 in the last 24 hours. Now, whenever I mention Sweden, I get attacked from both sides. I don't pretend to fully understand what's going on in Sweden. I strongly suspect that there's going to be a few PhDs done on the Sweden situation. It's not possible to keep up with it, but we do know that there's an increasing number of deaths. So cases and deaths. And the death rate in Sweden is currently higher than in its neighbours. So it's higher than Denmark, Germany, Norway, Finland and Poland, who are in the immediate geographical vicinity of Sweden. And like me, you've probably seen videos from Sweden with very limited social distancing. Restaurants are remaining open. Now, it looks like the response in Sweden is governed by epidemiologists, a particular epidemiologist, I think, rather than the government itself. Now, I might be misrepresenting him here, but it seems the strategy is to go for herd immunity in Sweden by exposing people in lower risk groups, so the young, the fit, and building up herd immunity in them. Then when a lot of those people are immune, they're going to, as it were, protect the more vulnerable people round about, because the virus will go from an infected person, then they'll bump into a person who has the immunity, and they won't spread it onto a vulnerable person. That seems to be their thinking. Not really commenting on it. It doesn't seem to be working because the death rates are high, but that seems to be what they're doing. And it works on trust rather than mandating on the whole. But it is interesting that some senior politician in Denmark was expressing reticence about, in Sweden, was expressing reticence about this. So it looks like the results for the Swedish experiment are not yet in. We will know in the next months if this experiment, and I think it is fair to call it an experiment, has worked. Unfortunately, I fear it won't. I do hope it does. Hope for the Swedes it does, but I'm not optimistic about a favourable outcome from the Swedish experiment. But hey, that's just my view. Now, Italy is interesting. We're going to look at Italy a bit today because that's the number of cases and that's the number of deaths. Now, what caught my attention today is Italy with Belgium are sort of pioneering the reopening of Europe, how things are going to be reopened. But things aren't reopening as they were before. So Italy is actually a very interesting case study that other countries will probably end up following as they try to reopen. So Italy is ahead of the curve. We learnt a lot from spread in Italy. We learnt a lot from medical treatments in Italy. And now I think because they're ahead of the curve, we're probably going to learn a lot about reopening strategies from Italy as well. So let's just have a brief look at some of the things that they're talking about now in Italy, how this reopening is going to pan out. So they're talking about 2.7 million people going back to work from May the 4th to get the economy going again. So 2.7 million people. Now, if people go to work on their scooter, motor scooter as they often do in Italy, that should be okay. But if they're going to work on crowded trains, then it's not. So this is an interesting part of the thinking that is being developed in Italy. So in order to keep the numbers down on public transport, they're going to say essential travel only. So people can't travel unless the journey is essential, especially on public transport. And passengers will be strongly advised to wear masks on public transport. Personally, I feel this should be mandated because I think it makes a big difference, as we saw from the Austrian data a few days ago. The cases were dramatically down in Austria after they mandated wearing masks in public. So strongly advised. Let's hope it becomes completely socially unacceptable not to wear a mask in public transport in Italy. Then infected people are going to keep the droplets out of uninfected people's mucous membranes. Masks are going to be mandated on flights, hand sanitizers on buses, trains, trams and many empty seats. So plenty of hand sanitizers all over the place. And they've got plans for this, so there's going to be empty seats. So this clearly means that each aircraft, each bus, each train can carry less people per journey, obviously. So that's obviously going to increase costs. And it kind of means that there could be 50 people at a bus stop, which is a concern because we don't want 50 people all together. So it's not only the public transport itself, it's getting on public transport and queuing to get on public transport. So public order is going to be absolutely essential in Italy. This is done fairly. And there are going to be people there to supervise this, apparently. But it needs to be done fairly because you could have a situation where a bus arrives with 25 spaces on it and 50 people are waiting. And there's going to be lots of empty seats on the bus, but the bus driver will have to say, well, no, every other seat is the what's mandated here. Or the other thing they had was circles drawn on the floor for people to put their feet in. So various social distancing ideas. And of course, the other thing that's going to be key that they haven't mentioned, but I'm sure they've thought of, is ventilation on public transport. these things need to be well ventilated. So if the windows are open, that's going to blow out any viruses and reduce the viral load in the air. Good ventilation in the workplace is also going to be vital. You don't see people talking about good ventilation very much, but do bear this in mind. Ventilation, if there's viruses in the air and you've got a breeze blowing through, it's going to blow out some of those viruses. It's very simple. Good ventilation. Now, there's going to be one-way lanes for passengers, so there's going to be a door in and a door out, and you're going to have to be on foot. This is talking about one-way. People on foot are going to have one-way systems. And this is going to have to be the same for shops. It's going to have to be the same for all sorts of things, that we have one-way systems so people aren't passing close to each other as they go back and forward. Taxis are going to be a problem. Again, good ventilation is going to be key here. But 2 or more passengers, then all must wear masks. Working times. We can't really have a rush hour. So working times for offices, factories are going to have to be staggered with varying shift and duty starting time, so that not everyone's using public transport all at the same time. Of course, as many people as possible will work from home, and for quite a few people it's possible maybe to work from home, say 2 days a week or even 3 days a week. Just go into the office twice, or not possible for everyone, of course, not possible for factory workers, but for a lot of people. And it's interesting the way that so much more work has now gone online. I think we've actually seen a major social change in the way that much work has gone online, and physical journeying is going to be less needed, which is good. Government wants to build more bike lanes, pleased to see that as a cyclist. More bike lanes. And offer incentives for bicycles and electric scooters. So this is personalised individual transport. Now, many people can cycle, that's fine. Great, cycling is good for you, but not everyone's fit enough to cycle. So relatively low-powered electric scooters that can go at the same speed as a push bike. For those that are unable to, say, cycle 3, 4, 5, 6 kilometres into work, makes perfect sense to me. So perhaps some infrastructural change there, or perhaps taking lanes that were used for cars and making them exclusively for push bikes and electric scooters. Because the big danger with cycling is that you get hit by a car. That's the big danger cycling. I was knocked off my push bike by a car a few years ago. It took me about a year to recover. I didn't fall off it myself. I was knocked off by a car. So we need to separate cars and bikes. So good to see that they're thinking about more dedicated bike lanes in Italy, which is good anyway. It's good for the environment generally. These measures are going to be necessary until a vaccine arrives. This is true for us all. Life is not going to get back to normal for you and me and planet Earth until we have a vaccine. Until then, there's going to have to be some degree of social distancing, in my view. Now, in Italy, they've got Back on Track project for work. Now, some of you aren't going to like this, but it's an app. So workers load this app up, and if someone gets the disease in their close contact, so if someone gets the disease at work, their close contacts will be alerted by phone, by text or whatever it is, or phone or bleep or something, and they'll be told to stay away from work. So using electronics to identify those that have the disease and those that are relatively safe and those that are at higher risk is going to be part of this exit strategy, I believe. And if someone says, well, you can download this app on your phone or you can not go back to work, I think most people will probably download the app on the phone. Right. Now, the people that are going to email me about this, that's fine. You can do. I've read George Orwell. I've read 1984. I've read Animal Farm. And the dystopian visions terrify me. When I was a few years old, my mother put me to bed and didn't know if she'd get me up again because there was a bit of an argument between Khrushchev and Kennedy. You know, I was brought up with the threat of totalitarianism. So it terrifies me as much as it terrifies you, but I don't like people dying of COVID-19 either. Now, China. Cases, those cases are wrong. I'll tell you why I believe that in a minute. Deaths. Now they're saying that's the cumulative deaths, cumulative cases, according to official Johns Hopkins Chinese release data. 10 days with no deaths in China now, and most of the cases are imported. So if true, that is remarkably encouraging. But we looked a few days ago at this study from Hong Kong, and they analysed the Chinese data using mathematical techniques I personally don't understand. But this reputable Hong Kong group, published in a reputable journal, said that as of the 20th of February 2020, there would have been that many cases in China. 232,000 cases in China on the 20th of February. So if there's that many accumulative cases on the 20th of February, there can't have been that many cases now, can there? But what the Chinese are reporting now is no deaths for 10 days, mostly imported cases. If true, remarkably encouraging. So there is evidence that that may be true actually from international journalists. So it just shows this virus can be massively suppressed with appropriate measures. Now, Sri Lanka caught my attention. They've got a nationwide curfew over the weekend, completely enforced as far as I can see, because increasing cases, although the official cases are relatively low, 427 deaths. I suspect they're underestimates because they're taking quite draconian measures in Sri Lanka to close things off there. Now, Anzac Day, 25th of April, based on the commemoration of the Gallipoli landings, of course. Australia and New Zealand Army Corps, Anzacs, who fought with great distinction and honour and bravery in 2 world wars. Closed services for Anzac. Normally Anzac Day, of course, is commemorated globally in Australia and New Zealand. But quite moving to see families at the end of driveways commemorating Anzac Day with great dignity and respect, I thought. So pleased to say that was being remembered. So while we're talking about the Antibodies, this is the current from the Australian dashboard. Encouraging, very little growth. So this is the cases, reported cases in Australia, and we see that recently very few new cases reported. So a very encouraging downward shape there in Australia. Let's hope that continues. Now this is actually New Zealand data, so this is total confirmed and probable cases. So as we'd expect, that's gone up. But there we see that's nicely levelled off, hasn't it? Is it still going up a little bit there altogether? Maybe, but these are the individual cases per day. So we see it was at the peak there, and look how dramatically it's gone down here with New Zealand measures. So real success story. Very similar shape graph to the Australian one, actually, to be honest. That's the Australian graph. And histogram rather, and that's the New Zealand one. So equally successful in New Zealand as the number of cases are decreasing. So new confirmed and probable cases there in NZ. Confirmed by diagnosis, probable by clinical diagnosis. Now this is interesting, the gender split in New Zealand. Now these are cases, total cases by gender as of 9 o'clock in the morning, 25th of April 2020. So 652 men, 808 women. Now remember, this is not complications. This is the actual number of cases either confirmed pathologically or clinically. So it's not commenting on complications. Is there any reason why men or women should catch this differently? No, I suspect this is an artifact of the way that the data has been collected. I'm not sure if my camera's working properly. Let me go back onto one screen. There we go. Total cases by age and gender in New Zealand. So thankfully total cases in the younger age group are less. Quite a lot of cases in young adult life in New Zealand. Again, that probably represents testing. We don't particularly think there's differences in the rate at which people get the disease. The big thing is the rate that people get complications of the disease. So active cases in New Zealand, the yellow bars, These are people actually with it now. The green is recovered cases, so this is good. Looking like the majority of the cases are recovered now in New Zealand. And thankfully, the death rate decreased is remarkably small in New Zealand on these older age groups. So still tragic, but remarkably small numbers there in New Zealand for death rate. So got to say the Antibodies is quite a success story. Now this is New Zealand. In imported cases, 39%. Import-related cases, that's people that caught the disease from someone who was travelling. Relatively small amount of community transmission. Locally acquired cases with epidemiological links. And with unknown true community spread, only 3%. So this is why New Zealand's been so successful. It's been able to isolate its infected cases and cases under investigation. So that's good to see. Now, I think I'll just show you this cinema on the screen now. This came from, I can't remember where this came from actually. South Africa. So someone without a mask. So what this is saying is that it's the infected person that's likely to infect the uninfected person. Now, I've no idea how accurate these numbers are, but it shows the importance of the infected person wearing a mask. And someone who's not infected, unless it's a N95 sort of proper PPE mask like you'd wear in hospital, it's not going to be very protective in public. Person with COVID-19 wearing a mask, even if those round about aren't wearing a mask, the transmission's lower. No idea if that number's right, but the sentiment I agree with. And if both are wearing masks, even less. So please refuse to relate closely with anyone not wearing a face mask. Any type of facial covering will do, as we've mentioned, because what we need to try and do is break up the momentum of the outward flow of air, as we've looked at before. Now, Gaza Strip. 2 million people in the Gaza Strip living in relatively small area, quite closely packed population. So if the disease develops community spread there, there's going to be a lot of transmission in the Gaza Strip. But so far, 17 no cases, and I think they must all be isolated because they're not reporting any community transmission. So that's encouraging. Let's hope that they can continue this isolation strategy of cases in the Gaza Strip. And we can delay any spread in the Gaza Strip, hopefully till a vaccine comes along. Challenging, although that will certainly be. Now, Turkey, 104 confirmed cases, 104,000 confirmed cases, 2,600 deaths. But the thing about the death rate in Turkey is the Turkish doctors can only say it's death by COVID-19 if they've tested for COVID-19. They can't do it on clinical grounds. And of course, there's not enough testing. So that means the real death rate is higher than that, because they're actually the number of people that have died with a positive test, positive PCR test. So the death rate is going to be higher than that. This is not a good way to collect the figures. But then again, in my country, we don't collect the figures well either, because we don't count deaths in nursing homes or at home. Or we do, but it's only it's late, as published by the Office for National Statistics. Now, the World Health Organization, which I agree with, recommends that we include clinically diagnosed, because doctors around the world now, nurses around the world, are used to seeing this. They recognise it. They can diagnose it now. So, systemic underreporting of deaths from Turkey. Argentina, this just concerns about South America generally, really. Prison riot in Buenos Aires. The prisoners saying that many in the prisons have chronic diseases. So, as we've said from the start of this, prisons have always been a concern. And like me, you've probably seen pictures of prisons in poorer parts of the world where the overcrowding is quite incredible, and spread would be guaranteed. Peru, cases, deaths, but they've been testing the police, and 1,300 police are tested positive, so the real cases are probably unfortunately higher than that in Peru. So where does that leave us? Europe is desperate for an exit strategy, and it's starting to work out ways to do it now. The United States are trying to reopen. The early reopening in the States is going to cause more cases, I believe, spread to the American heartlands, unfortunately. Relative success in Australia and New Zealand. Concerned about South America. And of course, you don't need me to say, again, I'm concerned about other places in Asia and Africa. Now, just to finish with a few pictures. Now, these pictures here came from May. And she's been working on ways to help people's ears, so it doesn't hurt their ears. So here we see this thing here that goes behind, and then means the mask is not tagged onto your ears all the time, which is a great idea. So people can wear this, and makes mask wearing, especially for people that need to wear masks all day, makes it much more comfortable. So I thought that was a great idea. Pity my pictures aren't behaving sequentially. Any style you want with buttons for the mask. All the best ideas are simple. So we see a headscarf here with the buttons, and the mask fits onto the buttons, and it saves the mask being around your ears all day, so you don't get pressure sores behind your ears. To the young lady in the picture, thank you for the picture. I'm sorry I don't know your name, but thank you for demonstrating that. I'm sure it can help a lot of people. And here's May making up all these masks, which is great, making up these buttoned straps. Now this is Nick, who watches me on a big screen. So my commiserations, Nick, but to be fair, it is your choice, mate. So, but glad to see you're watching, and do keep safe and well. Thanks for watching, Nick. Thanks for the picture. Now this is Sachin watching from India. So welcome. Thank you for watching. Thank you for the picture. And this is Mia and Khalil, if I pronounced Khalil's name correctly, watching in Thailand, all the way from sunny Thailand. So thank you for sending the pictures in. It's always nice to see that people are watching in various parts of the world. Thank you for watching.